Welcome to the doctor's office. Here, they put all the cards on the table and then they picked one for their role. Adri is a parent, Seville is a parent, and Princess is a parent. Then we have two doctors. Carter's a doctor, and Zong's a doctor. So here, if you decide to go into the doctor's office, you can have two doctors and three parents or patients. And here I have our three parents that are in the waiting room. And so, to be in the waiting room, who are your patients? Who are you taking care of? Who did you bring into the doctor's office today? What are in your laps? Babies. So let's find out to see what their baby's names are, and then what's wrong with them. So, Miss Princess, what's your baby's name? Melissa L. Remember Melissa L? Melissa L.
Melissa.
And what was wrong with your baby? Why did you bring your baby in today?
Because her tummy hurted and her eyes got wrong.
And here we have Seville. Seville, what's your baby's name?
Zavelli.
And what's wrong with your baby? What did you check? What's wrong with your baby?
Eye, mouth, and leg.
And here we have Adri. Adri, what's your baby's name? Okay, and what is wrong? Can we see your chart? Holman. And what's wrong with your baby?
He's hurt his ear, eye, nose, head,
And leg? It looks like there's a lot wrong with your baby. Hopefully the doctors can take care of that. So now that our patients filled out their forms, they're waiting in the waiting room for our doctors. Let's check in to see if our doctors are ready. Doctors, are you guys ready?
Yeah.
I have a question. What tools do you have to use on our patients today?
We have a shot. We have a medicine. We have this. I forget what it's called.
Ooh, is that to look into the eyes?
Yeah.
And the ears?
This is for testing your vision.
Your vision, your eyesight. And then I see we have a light table over here. What goes on the light table?
The X-rays.
The x-rays. How many of the x-rays can you have on the table at a time? One. Doctors, why don't you go check in with your first patient?
Oh, yeah.
Carter will go first.
So, what's your baby's name? Right? Is he a boy or a girl? A boy. Yeah. Anyone have a boy? How high is he? Say, like 6 inches. Little? Little. It's not funny.
They liked your answer. You're using our sorting terms. The baby's little, medium, or big.
Alright, what's your problem? Ears, eyes, nose, legs, and head.
Adri, what's wrong with your baby? What things did you check? What things did you check on your sheet?
ears, eyes, nose, legs. All right. We only have 4. What
Alright.
have you been having lately? Oh, milk. Milk. And water.
Milk and a little bit of water.
No. Have you been having rest? It's not water. Yeah, he was sleepy. Looks like
Mr. Carter, Mr. Kalb, why don't you bring your patient back into the doctor's office now? Can you guys face us? Mr. Adrian, Mr. Kalb, can you guys face us so we can see you? Well, he's a doctor, so he wanted to go by his last name. That's Carter's last name. Or Dr. Kalb. Sure.
We have an X-ray of we have 2 X-rays in the left. I'm gonna
Here's how we're going to do it. I'm going to drop.
It looks like the toes are.
Adrian, can you stand a little bit to the side?
To go to the X-ray so you can see the X. Toes are a little bit swelling. That's not a very good sign.
Well, it looks like the baby's toes are swelling.
That's hard to know. Alright. And now we have...
So, Mr. Kalb or Dr. Kalb, what do you recommend for this baby?
There is a small broken part in the joint, and the joint is a very bad place to have a broken bone. So,
What do you think Mr. Adrian should do?
cast for